In 2001, Dr. John E. Reese III identified a significant need for dental care among economically disadvantaged school children. What Dr. Reese discovered was that while the majority of these children were eligible for Medicaid, most had no regular dentist and received little to no dental care.
Well, back in the year 2000, the South Carolina Dental Association worked with the General Assembly of South Carolina to improve the Medicaid program. And as part of that, in order to improve the program, they wanted to get more doctors or more dentists encouraged to accept Medicaid. So I limited my practice to a certain number of Medicaid patients to help the process along. What I discovered was that the children were not receiving the proper care that they needed to function in life, and while there's access to care, sometimes issues hampered that access. So I decided in 2001 to develop a mobile dental clinic that we could go to the schools and see children on site at their schools during school hours to prevent the barriers to access that they were receiving.
As an outreach to his traditional practice, Dr. Reese began treating economically disadvantaged children on site at their schools in a mobile clinic.
As an experiment, I bought an RV, I converted it, put dental equipment in it, and we went to one school in one school district, and we started seeing children there.
In order to function more closely to his traditional practice than the one he was using, Dr. Reese designed his own mobile clinic and had it built to his specifications, the result of which became Dental Access Mobile Clinics, the only manufacturer of mobile dental clinics designed by dentists for dentists.
We actually have dentists who are involved in the manufacturing process, dentists that actually work on our vehicles, and having them involved makes them more efficient and more functional for the dentist themselves. A lot of companies have a engineer that's sitting in an office somewhere designing based on what looks nice to them, but it doesn't really help the dentist in what he's doing on a daily basis. So the dentists that we have involved with our units actually use them on a daily basis, and therefore they're much more functional and efficient for the dentist that's working in them.
Building for dental access, one thing that's really nice is we're working with a dentist. In our past experience, we've built mobile hospitals, and we've worked both with the military and with physicians. The idea is they know nothing about the structure, the substructure, the construction, the design. They know their field, they know what they want, but they don't know about the design. That's the perfect marriage, is to take and work with somebody like Dr. Reese in Dental Access and take and build what he knows he wants.
As popularity grew for Dental Access mobile clinics, calls for help in times of disaster became more and more frequent. But due to insurance limitations, Dental Access mobile clinics were powerless to help.
Dental Access Mobile Clinics was limited when we first started doing our mobile clinics in rentals because insurance companies were unwilling to take on the liability of people being able to drive these things away. So in times of disaster, we couldn't really help people because all we had was our mobile clinics, and insurance wouldn't allow us to rent those to other drivers. So we came up with the trailer design for the temporary dental offices so that we can actually take those up, set them up for the doctors. The doctors don't have to do anything but go in and do the dentistry that they are educated to do.
In the event of a disaster, insurance may cover the cost of repairing your damage and replacing lost income, but it cannot make up for the time and money you will lose by having to close down your office. For dentists, this is a very important aspect when dealing with such a disaster, because without the doctor, the value of the practice begins to deteriorate very rapidly.
When a doctor is unavailable in the practice, then that puts a lot of inconvenience throughout the entire network of patient base, because actually the practice is the doctor, or the doctor is the practice. So studies have shown that when a practice is not working, then the patients within 2 weeks will more than likely find some other place to go to that's more convenient.
Using the skills he developed in the design process of his mobile clinics, Dr. Reese constructed a temporary dental office that could be deployed in the instance of an emergency.
A temporary dental office can allow a practice to continue with little or no interruption by the convenience in and of itself. If there is a disaster, if there's a remodel, if there's some incidents that requires a practice to be down, Dental Access can have their mobile unit at the site within a week. So therefore, allowing them to continue their production and allowing them to maintain the convenience for their patients.
In addition to using a temporary dental office during times of crisis, the temporary dental office can be used to keep offices open during remodeling or reconstruction of an office.
Remodeling, whether it's in your home or an office, is always inconvenient. If it's in a kitchen, you got to figure out what you're going to do, how you're going to cook. The same thing goes in a dental office. Number one, we're going to try to be in a very sterile environment. Number two, you have patients coming and going, and you don't want the noise, the dust, the strangers, and then also one half of the office you can't work in while the other half of the office you can. So it is just a convenience factor to be able to have the temporary office set up outside.
Both mobile clinics and temporary offices are available for lease or for purchase through preferred lenders.
We have several different options available for lease and purchase of the mobile dental clinics and the temporary offices. Basically, the mobile dental clinics can be purchased either through a straight purchase or through a leasing option that allows you to lease the vehicle for a set number of years and then turn it back in at the end of the lease and walk away with no additional monies owed. And of course, we can also work out the same options on the temporary dental offices as well, or lease them to you on a weekly basis.
For more information on Dental Access, visit www.dentalaccess.com or call 803-324-3220.